Dear doctors, in all these years, from our student period and in all CMEs and conferences, we were hearing and talking about the need for regular medication for chronic diseases like diabetes, hypertension, psychiatric illness, etc. Even though we all know that the first line of management for lifestyle diseases like diabetes, hypertension, heart disease, and even psychiatric diseases like depression is lifestyle modulation. Unfortunately, we fail to motivate the patient for lifestyle correction. Instead, insist on regular medication. Now, with the cell activation support, it is easy to optimize your patient's lifestyle to prevent, treat, and reverse these chronic lifestyle diseases. In cell activation treatment, diabetic medication are stopped on day one itself. Cell activation treatment controls type 2 diabetes without insulin or medication. Diabetic medications are stopped to avoid hypoglycemic attack, and patient is encouraged to check blood sugar frequently in initial days to ensure blood sugar is under control. In type 1 diabetes, whether we can completely avoid insulin depends on the extent of damage to the beta cells of pancreas with the autoimmune process. As the type 1 diabetes occurs in children, if diagnosed early, there is a possibility to save some beta cells in the pancreas by slowing down or reversing the autoimmune process. Other medications like antihypertensive, statins, blood thinners, anti-allergic, antipsychotic medication, etc. can be tapered off gradually. The patients who are on regular medication for many years get addicted to the medicine physically and emotionally. So they need some encouragement and motivation to come out of that dependence on medication. Most difficult is to come out of psychiatric medication. In cell activation treatment, body get optimal nutrition, stimulation and protection from toxins, and the chemical composition of the body gets corrected. This optimizes the immune system, hormone balance, nervous system, etc. at cell level. So, taper off the regular medication for those chronic diseases slowly with frequent symptomatic and laboratory monitoring, and encourage your patients to come out of medication gradually. Encourage them to follow a healthy lifestyle and maintain the body composition and health achieved through cell activation. Let us together help to make our people live healthy, free from lifestyle diseases, free from lifelong medications, and to avoid surgical interventions for lifestyle diseases.